On this week's edition of New York Now, Governor Andrew Cuomo and state lawmakers strike an agreement on the state budget as New York's response to the coronavirus continues to grow.
New York is New York, and we are New York tough.
David Friedfeld from the Citizens Budget Commission joins us to break down the $177 billion spending plan. It might be just a matter of days before New York runs out of ventilators to treat patients with COVID-19. Joe Spector from the USA Today Network has the details. And private colleges are doing their part to help with the pandemic. Mary Beth LaBate from the Commission on Independent Colleges and Universities joins me to explain. I'm Dan Clark, and this is New York Now.
Funding for New York Now is provided by WNET.
Today, the Senate majority will pass
a law prohibiting it, and we will take them to court challenging it.
Get another stand for New York and sending a message to the nation.
Welcome to this week's edition of New York Now. I'm Dan Clark. The coronavirus has absolutely destroyed the state's economy in New York, but Governor Andrew Cuomo and state lawmakers were still able to pull together this week and approve a new state budget. The Senate and the Assembly passed the spending plan Thursday after the coronavirus threw a huge curveball into the state's finances.
I think despite all the back and forth, we can all agree that the budget that we are passing is not the budget any of us had hoped to pass at the beginning of this session. It's not even the budget we envisioned a month ago.
The $177 billion budget comes with a twist. Cuomo will now be able to cut spending throughout the year if the state doesn't have enough money. That means funding for school districts could be cut mid-year. More on that later. But first, New York needs more ventilators to treat people with COVID-19, and the state's stockpile could run out in just a few days. Joseph Spector from the USA Today Network joined us with the latest on COVID-19 in New York and more. Joe Spector from the USA Today Network, thanks so much for being here for our Digital Reporter Roundtable on New York Now this week.
Thanks, Dan. Digital indeed.
Yeah, we're doing things very differently nowadays. So
Yes.
I want to start with the governor's briefing on Thursday, where he said something that was very striking. We've been talking about ventilators for weeks now because ventilators are the key here to treat people that are going to the ICU for the coronavirus. He said on Thursday that the state's stockpile would only last, given the trajectory of where things are going, they would only last 6 more days, which seemed like an astounding number to me at the time. But apparently the state has some options going forward. Tell me about what he said they're doing to kind of prepare for the stockpile to run out.
That's right, Dan. It was certainly a scary prognosis when you think about how you look at these charts every single day. We get those briefings every single day, and those numbers just go up and up. The number of cases, the number of deaths exceeded 2,000 on Thursday. And so the problem all along, and Governor Cuomo has talked about it, everyone's talked about it around the country, is the lack of ventilators. And when that day would come, when New York might very well be out of them, and Governor Cuomo indicated that that day might be 6 days away, and that was certainly sobering to hear him say that. But he did try to caution that with the idea that there are, one, trying to procure as many ventilators as they can from around the state, around the world, in fact. But secondly, he talked about the various options that New York might have. That's using ventilators that are used for anesthesia and converting those into ventilators that can be used for people who are suffering from respiratory problems due to coronavirus. There's other types of machines that can be turned into ventilators, perhaps using ventilators. And he's talked about this for a while. Having 2 people on one ventilator, creating tubes that can serve 2 people at once. So those are some of the options they're considering. And, he said he remains hopeful that there'll be enough to serve everyone. But clearly, as you look at the trajectory and the number of ventilators in New York, it's reason for serious concern.
The big hotspot in the state right now is New York City. Over half of the state's cases right now are in New York City. But a month ago when this all started, which it's crazy to even say that it only started a month ago. A month ago when this all started, one of our first cases was in New Rochelle, and the USA Today Network has covered that like nobody else. It's been fantastic. What does it look like now in New Rochelle? Have things calmed down? Because maybe that's an indicator of what we'll see going forward.
Well, it is. Thank you for saying that. It has been a fascinating situation in New Rochelle. As far as we know, there was no deaths associated with that cluster in New Rochelle, which in and
Wow.
of itself is remarkable. The patient who is believed to have spread it to congregants in the Young Israel synagogue, he in fact was in grave condition, but now he's home and appears to be getting better. It was really a weeks-long saga for the people in New Rochelle. Initially, 1,000 people were quarantined there, and then subsequent to that, about 100 remained on quarantine until about a week ago, when the state finally decided that people did not need a second negative test to come off quarantine. They're going to let people off after they're asymptomatic for a number of days, even after they test positive. And so what's resulted is a positive thing in that earlier this week, people from that congregation started giving blood to researchers at Mount Sinai and other New York City hospitals, hoping that their plasma and their antibodies can be used to help people who are very sick with coronavirus.
That is so cool that they're able to, after recovering from this, hopefully help some other people get through this disease. In terms of the trajectory, we've heard this word several times over the past month. It's an apex, which is, from what I understand, when the state's hospital capacity would meet the number of cases and maybe we would be overwhelmed. What are we seeing with that? The governor's talked about this in the past few days. Is it 7 days to 30 days? Did I get that right? What are we projecting, I guess?
Yeah, I mean, it's hard to know exactly when that apex will be reached. And I think the governor has talked about that. But, every day there's sort of this headline number that comes out of these briefings. And the one from, I guess it was Wednesday, was that there might be 16,000 people who die in New York. He based that off of some national projections from a group associated with the Gates Foundation. They estimated 100,000 deaths nationwide and 16,000 of those in New York. So that really was, again, another hard to take number. But that's the question. When will the apex be reached? How many people will die from this in New York? Right now, New York is really the epicenter. I mean, it's not even close when you look at the number of cases and deaths. No state is in the position that New York is in.
So let's turn to the state budget, because while the coronavirus pandemic is probably on everybody's minds right now, we also had a spending plan pass this week in Albany. It's huge. I can't believe that they got so much into this thing while also dealing with this global pandemic. So I won't make you talk about all of it, because we have a whole bunch of issues like changes to Medicaid. We have legalization of gestational surrogacy, a ban on flavored vaping products, legalization of e-bikes and e-scooters, which a lot of people were very happy about. You've been covering Albany for more than a lot of people that I know.
Yeah, right.
How is this? How is this
20
budget?
years, I guess.
Yeah.
Keeping track of it. Yeah.
It's been a little while. How is this budget different from budgets that you've seen in years past? Is it bigger? Is it more complicated? And I guess what sets it apart from other spending plans?
Well, it's like nothing else. I mean, you think about the state budgets after 9/11. You think about the state budgets after the recession in 2008, 2009, when New York had a $17 billion budget in 2010 under then Governor David Paterson. So you're dealing with those kind of numbers as far as the budget deficit will be, but you don't know what the budget deficit's going to be and how it's all going to shake out. I mean, that's certainly one of the main reasons that this sets us apart from other budget years. No one can tell you how much revenue the state is ultimately going to lose when the coronavirus subsides. They're passing a budget really not knowing the extent of the damage, but they had an April 1st deadline. They're a day or two late, but, under the circumstances, timely, certainly to say. And,
Right.
We're going to have to see how it plays out. This isn't a budget where, they pass it and they go home and they say, that's it. We'll see you next year. We'll deal with this. This is going to be a process that's updated quarterly, if not sooner, as they figure out what revenue they have and what they could spend.
And we'll definitely have you back to talk more about it. I don't want to get into the details of the budget because there's just so much. So we will leave it there. Yeah. Joe Spector from the USA Today Network, thank you so much for joining us via Skype for New York Now this week.
You got it, Dan. Thanks.
Thanks to Joe for that update. Now for more on the state budget. School aid won't increase this year, and new legislation will allow Governor Andrew Cuomo to cut school funding mid-year if he needs to. David Friedfeld from the Citizens Budget Commission joined us with the details. David Friedfeld from the Citizens Budget Commission, thanks so much for joining us here on New York Now this week.
Thanks for having me.
So we are in the midst of this mega state budget that the legislature is passing this week. Of course, we are talking late Thursday. The budget has been not totally approved, but there's a deal, so we know mostly what's in it. And kind of a really interesting thing that's in it is this new provision that would allow the governor essentially to change how the state spends its money at different points throughout the year. David, why is this in the budget? What was the governor's rationale for wanting to adjust spending throughout the year?
Well, the governor has requested somewhat similar powers in years past. This year, since the executive budget came out in January with slight adjustments in February, we've had a worldwide pandemic, and the economic and financial impacts on New York have been severe. So the governor requested this authority really to make changes partway through the budget year. So to a certain extent, the state's going to say we're going to spend X dollars on education, let's say, and then partway through the year, the governor basically by himself would be able to cut that spending amount and then reduce aid to school districts and anybody else really who's getting state money.
So how do these school districts and local governments plan their budgets over the next few months? I mean, school budgets are going to presumably, I think, be voted on in May. How do schools look at something like this and say, we're going to commit this spending and maybe we won't get this money in the end?
And that's a really important question. It's going to be very challenging for school districts. I believe they pushed back the school vote until June at the earliest at this point. But still, it creates a significant problem. You know, I'm a former county budget director, and even if you tell me that I'm going to get much less money than I was hoping to get, if I know what that number is, it makes it much easier to do a budget, as painful as it may be. If that number decreases throughout the year, it makes it much harder. And even to achieve the same savings that you'd need, to a certain extent, if you're making cuts partway through a year, those cuts have to be twice as deep in order to get the same annualized savings. So if those cuts do end up coming to fruition, it could be painful for school districts.
This year, the budget is keeping school aid flat. Is that right? Or are they getting any extra money from anywhere? Or are they going to essentially expect what they got last year is what they're going to get this year?
So they're basically going to get what they got last year. It's going to come from kind of some different pots. The federal government, as part of their most recent aid package, is giving New York about $1.127 billion in additional aid. So basically what the state is doing is telling school districts, you're going to get what you got last year with some changes for expense-based reimbursements. But then some of the money is going to come from the federal government as opposed to the state. So basically, the state's going to get $1.27 billion. It's going to have to provide 1.27 less to the school districts, but the school districts will still get the same amount as last year.
We've talked about before how school costs play into people's property taxes. People around the state typically see their, they call them school taxes, really be a big part of their property tax bill. But another part of that is Medicaid. And they may not realize that because it's on the county level and not everything translates down to what you see on your property tax bill. So in terms of Medicaid, there were some changes in the budget. There were a lot of them, so I won't make you go through all of them, but can you kind of give me a brief overview of how the budget is going to change Medicaid in terms of spending, and will we see any services cut? Because I know that was a concern.
Well, certainly the intent is not to really cut services, but to streamline services and to ensure that the state is getting the best value for its dollar. A lot of the controversy came about because in fiscal year 2019, the state overspent its budget by $1.7 billion. About 8% of the state's Medicaid budget. It just went over what it was supposed to spend, what it had budgeted. They kicked that money into fiscal year 2020. In response, the governor created the Medicaid redesign team to come up with savings. And those savings were supposed to be presented to the legislature in the middle of March. Now, those savings came out at a time of a global pandemic. And at the same time, the federal government was increasing the state's Medicaid reimbursements. And part of that change was that the state couldn't make substantial changes to the Medicaid program in order to get that enhanced reimbursement. So basically what the state budget seems to say, and it actually just came out recently, but it seems to say that the state is going to implement many of the changes recommended by the Medicaid redesign team, but in order to ensure they can still get that federal money, those changes won't take effect until after the enhanced federal aid goes away.
So I know it's early, but when we're looking at issues like Medicaid, when we're looking at issues like education, school aid, I always come back to property taxes. And with these changes in the budget, is it out of the realm of possibility that people may see their property taxes go up this coming year more than they usually would because of these changes, or should we expect more of the same increase?
I mean, that's really going to depend on the individual municipalities. One of the biggest pressures that you'll see is actually a decline in sales tax revenue. So for counties specifically, their main sources of revenues are sales tax and the property tax. Property tax revenues, even in a recession, usually stay pretty stable. You have some increase in delinquency, but for the most part, property tax levels stay stable. Whereas sales tax can drop off considerably, and especially this year when you have restaurants closing and retail really falling off, and so many people just being forced to stay indoors. You'd expect to see a real significant decline in sales tax, which then puts pressure on your other your other revenue source, which is the property tax.
So with all of that, and I know again it's early, but there have been hints of the question, are we in a recession? Are we entering a depression? Where's our economy right now, I guess? Have we declared it as a recession? And what does that mean for the state budget this year in terms of long-term economic stability for the state? Because as we were saying over email, we were chatting, and you said that a recession would, the real effects, it almost worsens in the second year. So what are we seeing right now, and what are the long-term implications?
I mean, the definition of a recession is in some ways, unimportant because it's, 2 quarters of decline in gross domestic product. But what's important is that people are really hurting right now, and you'd expect that to continue, unfortunately. So in the first year of a recession, we've gone back and looked at the past few recessions, and you'd expect to see state revenues decrease from year to year by a little more than 3% in the first year. In the second year, you actually see a bigger drop off, a further decrease of about 6%. And that's where you have kind of the bigger revenue decline, and that's where things are harder. And you've also already kind of picked the low-bearing fruit if you're the state. For the state, you've already done the things that are a little bit easier to do from a budget perspective. So as hard as this budget is, unfortunately, next year, it could be worse.
All right, well, we'll keep an eye on it. David Friedfeld from the Citizens Budget Commission, thanks so much for joining us here in New York Now via Skype this week.
Thank you.
So we told you earlier about New York's lack of ventilators, but the state also has a shortage of medical supplies. New York's private colleges and universities could play a big part in helping fill that gap. Mary Beth LeBate from the Commission on Independent Colleges and Universities joined us to explain. Mary Beth LeBate, the president of the Commission on Independent Colleges and Universities, thanks so much for joining us here this week on New York Now.
Thanks for having me, Dan.
So I want to talk about 2 parts of your job and your organization. The first, I think, is great. So you represent these not-for-profit and independent colleges, higher education facilities, and apparently they are doing some help with providing medical supplies statewide. Tell me about that effort, because I think that's fascinating.
Yeah, sure. Thanks for asking, because I think we're really proud and pleased with what our schools have done. We got a call pretty early on from the state asking if we had what they call PPEs, masks, gowns, gloves. I immediately put out a call to our schools, and I tell you, Dan, they couldn't have been more eager and more helpful. Many schools had already been working with their local healthcare networks to provide all of their inventory. Our schools in New York City, in particular, started delivering things to the Javits Center almost from the moment that we asked. And I think in total, we've done 40,000 gloves, 10,000 masks. We're printing PPEs with our 3D capacity. We're even looking at potentially being able to fabricate respirators and ventilators. So it's really been an all hands on deck effort, and I'm really pleased with what we've been able to do so far.
That's fascinating. So you said that some of the colleges might actually be able to make this PPE and the ventilators. Do you know what facilities we're talking about, what colleges, and where they would be around the state?
A lot of schools, particularly your research schools, have 3D capacity. So you have places like Columbia, you have places like Syracuse. They believe they have the capacity the know-how to make math through 3D. We've gotten some specs from the state. We've shared those specs. I haven't checked in with them of late as whether they're producing, but last I knew they were going to try to churn out as many as they could. It's really this confluence of our technological prowess and the needs of the state right now.
This is very cool. So you said the state is kind of sending these plans, the specs, as you say, and then the colleges can take their 3D printers or whatever printers they have and kind of plug them in and make these machines in this PPE.
Correct. Certainly not at the scale of a major manufacturing facility, but I think at this where we are right now, every bit helps, and our schools want to be helpful.
Absolutely. So as far as every bit helping, I want to turn to the other side of this conversation, which I think is about revenue. There are so many colleges and universities around the state, especially the ones that you represent, in practically every county of the state. And I'm thinking of cities like Ithaca that has private colleges that it really thrives off of, places like Syracuse. What are we seeing in terms of the economic impact of having these facilities essentially shut down? The employees aren't allowed to work there, and the students aren't there right now, obviously, because they've been sent home.
Right. Well, we are, Dan, as you say, we're major employers throughout the state. We're if you looked at us as an industry, private colleges, we're almost a $90 billion industry. We support 400,000 jobs. And unfortunately, I think it's all too real to communities now just how important we are in the communities and for the economic viability of the communities. Because when we made the decision to send our students home, and our private colleges made that decision a little before it was a mandate of any sort, and it was a really agonizing decision for our schools. We looked at what would be the best interest of the community, the best interest of the health and safety of our students. And it became very obvious very quickly when students were directed to leave and continue their studies remotely, just how important a role we play in local economies. I saw it here. I live in Saratoga. We have Skidmore College. You saw it immediately before the restaurants and before the bookstores and the bars were all closed. You saw that the absence of students, the absence of faculty really made a difference on day-to-day commerce. And I'm sure that's being felt across the state right now.
So what do you do whenever all of this is over? What do you do as private colleges, non-for-profit colleges to recover? I know that tuition is obviously a big revenue for you. You get some aid, I'm assuming, from the state and the federal government, but what do these facilities look toward when they're looking down the line and saying, well, we have to rebuild?
Right. Well, in some ways, Dan, we're like any small business, but we've been through this. We haven't been through anything quite like this. No one has, but our schools have been through challenges, and our schools have been proven themselves to be incredibly resilient. I have no doubt they will continue to be. I think we've made that transition to remote learning for as long as we need to do it. And we know it won't be forever. We hope it can be for as short of a period of time as necessary to ensure everyone's health and safety. But, I think we are resilient. We'll make whatever moves we need to make to ensure that our students continue to get a quality education. We still have students who are putting down their deposits to come to us next year. We think that's the greatest thing people can do is just to move on with their lives and get on with the plans that they have had all along. So I'm confident that we'll be able to rebound. We know we will need help. The federal CARES Act did give colleges and universities and their students some aid. It certainly wasn't as much as we had hoped for, but I think it was a good start to let us, and importantly let our students, cushion some of the blow that we're feeling here.
When you're looking at your response to the pandemic and in the context of sending students home and doing this distance learning, have you heard from any colleges and universities how it's been working out, how students have been responding to this really new way of taking their education to a totally different place than they had to before?
It's not ideal, but boy, I tell you, I've really never seen faculty and students rally like this before. And I think to some extent it's almost creating a closer faculty-student bond, because our faculty is really going out of the way to make certain that students are comfortable with it, that they have the technology they need. I know with my own daughter who goes out of state, but she has been talking to her professors more now via Skype and whatever other means than I think she ever did when she was in class with them. So in some ways, I think in the end, it'll bring the community closer together. It will, I think, really impress upon students just how, what a cherished thing it is to be able to go to a campus and get that kind of learning. So I think it'll make them even more eager to get back when the time comes.
Well, we'll see how they handle it when they come back in the fall, and then they got to take home the homework. But I think you're right. I think that they will enjoy going back to campus in the fall. We'll leave it there. Mary Beth Labate from the Commission on Independent Colleges and Universities, thank you so much for joining us for New York Now this week via Skype.
Thank you, Dan, and be well and be safe.
That's all the time we have for tonight's show, but join us online every day. We're providing daily updates on the coronavirus and more at nynow.org. And follow us on social media at nynow_PBS. Until then, thanks for watching this week's New York Now. Have a great week and be well.
Funding for New York Now is provided by WNET.